Welcome back to Breaking Through with me, Kristen Rao Finkbeiner, powered by Moms Rising. We have a spectacular guest with us today, Natalie Kean with Justice in Aging. Welcome, Natalie.
Thank you so much, Kristen. I'm really excited to be here and to talk about Medicaid. It's one of my love languages. So,
I love Medicaid too. A lot of people don't realize how much Medicaid is woven through our entire patchwork healthcare non-system in America. And I say that because there's a lot of parts of the healthcare system. There's the ACA, there's Medicare, there's Medicaid, there's SCHIP, there's more. And so I'm wondering, to start out, can you talk a little bit about how Medicaid is situated in the web of healthcare programs in America?
yeah, so Medicaid is one of the core programs. It was enacted at the same time as Medicare. So it has a long and rich history and plays a very, very important role for older adults. Medicaid's really an anti-poverty program, and that's what it was created for, to help us fight poverty. And it's really core to our mission at Justice in Aging. That is our mission, to fight senior poverty. And it's really important for older adults and older women in particular. I don't think most people realize until they're older themselves or helping care for an aging parent or other older adult in their life, how much heavy lifting Medicaid does. It
Medicaid
really,
Medicaid is under attack over and over again by Republican leaders and Donald Trump. It's unbelievable how much Medicaid is under attack. I mean, I cannot even believe it because it's
yep.
a program that actually boosts our economy. It boosts families. It helps our elders. It lifts our families. There is so much data about how Medicaid really helps America.
Yep.
And so, can you share a little bit more about why Medicaid is specifically important for older adults?
Yeah, so Medicaid is filling in the gaps in Medicare. So people are much more familiar with Medicare. That's the program for people age 65 and older and people with disabilities. But Medicare is not free. It has monthly premiums and cost sharing, and it's Medicaid that steps in to help over 12 million older adults and people with disabilities afford to access their healthcare coverage. And Medicare also doesn't cover things like routine dental care, vision, or hearing services. And Medicaid is helping many older adults access those basic healthcare services. And then the biggest gap, which I know you know, Kristen, is where Medicaid is just so indispensable in terms of long-term care. It's the primary payer for both care at home as people age and for people with disabilities, and then also for care in nursing facilities.
It's huge, you all. It's
Yeah,
huge. It's so important. Medicaid is so important. It's like the unsung hero of healthcare. And again, the unsung hero has been eviscerated by Donald Trump and Republican leaders. And I think evisceration is the right word. Can you share a little bit with our listeners, with our audience, about what the heck just happened to Medicaid in the Budget Reconciliation Act of 2025? I mean, it's really bad. What's been cut?
yeah. So $1 trillion has been cut from federal spending on Medicaid.
With a
Uh,
T,
yes,
like Triceratops?
exactly.
Yes.
Yeah. I mean, it is by and far and away the largest cut ever to this program. And so we're just beginning to feel the effects of it. This these cuts are going to reverberate for decades and decades. But what we're seeing is that this gutting of federal funding is, pushing costs to states. States have to balance their budget. They share a portion of Medicaid costs with the federal government. And what they're doing is proposing to cut the Medicaid programs that support older adults and people with disabilities to live in the community. That's the first thing to be cut. We warned Congress and everyone who would listen, or even if they wouldn't listen, we warned and warned that this would be the result of cutting Medicaid at the level that Congress has, and sadly, it's happening. And some in the Trump administration and leaders in Congress, they aren't done. They want to keep cutting Medicaid.
I mean, I can't even believe it. My jaw dropped when I saw the proposed budgets for 2026 and beyond, cutting Medicaid even more. The thing that's important to notice is that if we're lucky, we all age and get older.
Yes.
And we need everybody to be able to age with dignity. And what we just heard Natalie say is something really important, and that's that the home and community-based services part of Medicaid took a really big hit. Research shows that if you can get access as you're aging, hopefully with the ability to have home and community-based services, that actually helps save costs, lower costs, because you avoid costly longer-term facilities, costly longer-term hospital stays. It actually helps also increase the dignity and the happy lived experience of people as they're aging. And also, there are healthcare workers. Home healthcare workers are an incredible field of people who also need to be treated with dignity and paid living wages. All of this just took a big hit. And when we're talking about a big hit, one of the things that Natalie mentioned that I just want to underscore is we haven't seen the full impact of the Medicaid cost cuts that happened from Donald Trump and Republican leaders yet, because they actually staged the cuts over time. So we're in a period of time where there will be increased cuts, many of which happen after the midterm elections. And so we won't see the full negative impact yet. So if you think your healthcare costs are high now for you, yourself, or a loved one, they're about to get a whole lot worse. We need Congress to reverse the cuts. And here's the thing. There's hope, because we can actually reverse the cuts. We're going to potentially need a different leadership in order to reverse the cuts, or, maybe fully need different leadership to reverse the cuts. So I'll say that. But it is possible to reverse the cuts. Can you talk a little bit more about the effects cuts to home and community-based services, which some people call HCBS, including me, that are happening through the cuts to Medicaid, and why that's so important to protect?
Yeah, so I mean, you hit the nail on the head that this is a privilege to age in this country, and unfortunately, it shouldn't be a privilege to age with dignity. But Medicaid is so critical, and really the only program that helps older adults grow old and be able to stay at home and connected to their families. We know this is what the vast majority of people want to do. And with support of Medicaid, they can do that. But if they don't get that support, people who don't need or want to be in a nursing facility end up there, because that's the only option for them. So some of the cuts we're seeing, whether it's states are proposing to end programs completely or cut the number of hours that someone can have a, personal care aide come and help them every day, or cutting the reimbursement rate for providers. That just translates into either stagnant or lower wages for the direct care workforce, which is already in a crisis because they are underpaid and undervalued. So the result, whatever the shape of the cut is the same. It shifts costs to families. People have to go into institutions, which cost everyone, including the state and federal government, more money. And sadly, it can be a matter of life and death for older adults and people with disabilities, whether they get these home and community-based services.
It is so important. And I know you just mentioned people with disabilities as well. I'm wondering if you could share a little bit more about how people with disabilities are being disproportionately negatively impacted by the Medicaid cuts that Republican leaders in Congress and Donald Trump have been pushing forward and continue to push forward. Just absolutely ridiculous.
Yeah, so the cuts that are, continuing to be called for are more directly coming at aging and disability supports in Medicaid. Over 70% of optional spending that states have under Medicaid. So this is the services that they can choose to provide or not. Over 70% of that supports older adults and people with disabilities. So now, we're seeing it at the state level that states are cutting back on those services, and then we're seeing further calls at the federal level directly targeting those services as wasteful or unnecessary spending, and it's couldn't be further from the truth.
Could not be further from the truth. The picture that is painted of the people who need access to Medicaid is very different than the people who need to utilize and actually are utilizing Medicaid. And I'm wondering if you could share a little bit about that. I know I'm putting you on the spot right now, but it makes me so mad when I read, like Republican leaders in Congress description of who's being cut, and then I know who's actually being cut. And that comment that you just made brought that up for me. So I wonder if you want to share.
Yeah, absolutely. I mean, again, I said this earlier. We warned that this would be the result. There's no way to cut Medicaid funding without harming older adults and people with disabilities, because the program is just so critical for them, and especially for these home and community-based services. Um, and so that those are the primary people who are being hurt by the cuts. And then, looking at just who is enrolled in Medicaid, it's a lot of caregivers as well, and a lot of women are enrolled in Medicaid because they have taken time out from the paid workforce to provide care for their families. So, it's going to hit older adults and people with disabilities in multiple ways, whether it's their caregiver losing coverage or having to go back to work, or direct cuts that we're seeing to these programs.
What can people do? I hope people who are listening and watching are just like outraged like I am and want to take action. How can people take action, and how can they take action also with justice and aging?
Yes. So I think telling your care story is always the most important thing. I guarantee an older adult in your life has depended on Medicaid. So what would it mean if that support went away? I think sharing that to your lawmakers, but also your neighbors, writing letters to the editor in your local paper is super helpful. And then we are really encouraging people to get involved at the state and local level, talking about the need to invest in these services. So states are cutting home and community-based services because federal law allows them to, and they're under budget pressure. But that's not the only option. States could also be raising revenues. And it's really important for people to weigh in and say, we need this, we need investments in our care.
Thank you so much. Last question. How can people get involved with justice and aging? Where's your URL? Where are you on socials? What's happening?
Yeah, so we are at justiceInAging.org, and we have a ton of resources and materials, a lot of webinars and things that go into detail on all these programs, and it's all free. So we welcome you to join and sign up for our listserv there. And then also find us on Blue Sky, on LinkedIn, on Twitter. I'm Kean, Natalie on Twitter.
Thank you so much for being on, Natalie Kean with Justice and Aging. Thank you.
Thank you.